Hello everyone, myself Dr. Pankaj Khade, and today I am going to discuss about rehabilitation of maxillary defects due to carcinoma and mucormycosis. We all know that there are various etiologies for maxillary defects. So it can be congenital like cleft lip and palate. It might be acquired due to surgical resection of tumor, or it might be traumatic, or certain infections like mucormycosis or aspergillosis may lead to these maxillary defects. Before few months, we came across so many maxillary defects due to post-COVID mucormycosis. Then these maxillary defects, they can be drug induced, like a drug in the category of cocaine, or it might be because of inflammatory conditions like Wegener's granulomatosis or midline granuloma. These are various maxillary defects depending on the extent of maxillectomy and also the location of maxillectomy. So we can classify these maxillary defects accordingly. Now this is a case of mucormycosis which was surgically treated and the primary closure was tried, but it was not properly achieved, and you can see that there is a difficulty in prosthetic rehabilitation because you need to totally depend on the residual maxillary teeth, as there is no defect available which can be used as a retentive measure. And for such kind of defects, you can fabricate these plates where incorporation of soft tissue liner of these silicone materials can be done to make them more stable and retentive. Now, this was a case which was surgically resected due to mucormycosis, and you can see that the bone is not available in that region. So again, you need to use the remaining hard palate and these abutments for rehabilitation. Again, similar case where the maxillary resection has been carried out. Now, this is another case where the maxilla was initially infected due to mucormycosis and the lesion got extended into mandible. And for these kind of cases, composite resection of maxilla as well as mandible is carried out. So it's a very challenging situation where you have to rehabilitate the maxillary defect, and along with that maxillary defect, there is deviation of the mandible, which needs to be corrected. So you have to fabricate a composite prosthesis where there is combination of obturator as well as guide flange prosthesis. Now here you can see that after resection of mandible, there is as well as maxilla, there is trismus due to the surgery. And for this purpose, you have to use certain measures like exercise program or physiotherapy so that the mouth opening can be improved over a certain period, and then impression can be made to fabricate obturator. So this is a hollow bulb obturator which was fabricated. You can see that the hollowness will make it light and more acceptable. And once the patient will get accustomed to this prosthesis, we can add guide flange to this prosthesis. Now, there are several factors which can affect the prosthodontic prognosis, like volume and location of post-surgical bony anatomy, mouth opening, availability of abutment teeth, size of the defect, radiation therapy, and neuromuscular control of the patient. So availability of teeth is very important factor, and for this you need to maintain coordination with your surgeon so that maximum abutment teeth can be preserved. Now here you can see that few root stumps and abutment teeth were preserved, and these root stumps can be utilized for placing certain attachment which can be used for fabrication of this definitive prosthesis. Now, incorporation of skin graft is very important because they will make the tissue in contact with prosthesis more resistant, and apart from that, they will prevent granulation of the resected margin. And because once it starts granulating, or once it will be left to granulate, it will lead to poorly keratinized nasal mucosa, which is not resistant, and it will affect the prognosis of your prosthesis. Now, while comparing the surgical and prosthetic rehabilitation, For a smaller defect, you can certainly go for surgical rehabilitation. But if the defect is very large, then you have to decide wisely whether to go for surgical resection or prosthetic surgical rehabilitation or prosthetic rehabilitation, because the masticatory function will be very difficult to restore once you will go for surgical rehabilitation. Now, this is a case where we had fabricated cast metal framework obturator, and you can see that the framework was tried and then the jaw relation was recorded, and after trying we fabricated this hollow bulb obturator so that the acceptance of the process can be better, and you can incorporate these characterization pigments so that the aesthetics can be enhanced. You can see the difference before and after prosthetic treatment. Another case where resection of maxilla was done in completely edentulous patient. So similar technique was utilized and hollow bulb obturator was fabricated. Now this is another case where resection of maxilla, and this maxillary defect was extending into the orbital region. So the size of bulb was relatively large, so we had to fabricate this hollow bulb obturator, and you can see the characterization has been done to match or to improve the aesthetics, because this patient was having melanin pigmentation. This is another case where we came across very small defect, and we had to use very precise mechanism. So we use these semi-precision attachments, and here you can see that the process was written with the help of these attachments. Then this is one more case where we use semi-precision attachments, and this bar and clip mechanism was used to retain and improve the stability of this maxillary obturator. Again, another case where hollow bulb obturator was fabricated, and you can see the difference after prosthetic rehabilitation. When the defect is extending into the soft palate, you need to go for two-stage impression technique. And in larger defect, you can use this press strut technique, or magnets can be incorporated, or this HDB silicone can be used. So this is another case where a cast partial obturator was fabricated. For soft palate defect as well, you can go for this cast partial frameworks. This is another case where we had used a two-stage impression technique to restore the soft palate defect. You can also go for maxillary grafting with fibula, and they can be restored with implants. So coming to conclusion, prosthetic rehabilitation helps to reinstate facial appearance, speech, and masticative function, thus improves patients' quality of life in patients with maxillary defects. Thank you.